Right. Hi, everybody, and welcome to this TechNet webinar led by Path Ideal Vietnam. The topic discussed today is public-private partnership in immunization data strengthening. And we are delighted to welcome Dr. Ngan Nguyen Thuy, Path Vietnam Country Director, as well as Ideal Vietnam Project Manager. She's led all the projects on the Vietnam National Immunization Information System since its initial stage a decade ago. The presentation will last about 30 minutes and we'll have 25 minutes for questions and answers. Please use the chat or the question and answer area to ask your questions during the presentation. So you can ask your questions during the presentation. They will be answered after the presentation is finished. And then you can also ask more questions if you have additional questions. Finally, we'll share the recording of this webinar and the presentation of the TechNet Forum on the TechNet Forum and by email with all people who registered. Dr. Nga, the floor is yours.
Thank you, Alex. Hello, hi everyone. Can you hear me well? Good morning, good afternoon, good evening, wherever you are. We are very pleased today to share with you one of our lessons learned from our series lesson learned from Vietnam EIR deployment. So as Alex just said, it is very long journey, almost more than 10 years of this initiative from very small scale pilot in one digit only. So now it's nationwide application to on over 63 provinces and more than 11,000 commune health center. So join with us today in panelists. We also have Dr. Đặng Thị Thanh Huyền, Deputy Director, National Expanded Program on Immunization, and National EPI have been together with us for almost 10 years journey from small scale pilot to now with NIIS, National Immunization Information System. And join also another colleague from IDEO team, Mr. Đào Đình Sáng, IDEO team lead at Vietnam, and Nguyễn Xuân Cẩm Tú, program officer. So I'll share with you about the public-private partnership in immunization data strengthening. Yeah. So I would like to invite Mr. Đào Đình Sáng to touch further information on the next section, please.
Thank you, Dr. Nga. Hello, everyone. So we are here very happy to share our lesson learned about the public-private partnerships in strengthening immunization data in Vietnam. This is the combined from our two lessons learned. One, the mobile the network operator partnerships in action for health and the private engagement. So I would like to introduce something about the Vietnam immunization systems in the context. So I don't want to repeat about the EPI system in Vietnam again, but I just want to show you that in the chart you can see that the contribution of the fee-based immunization facility in immunization service in Vietnam. So they are operated by both the public and the private sectors. So they are report directly to the provincial health departments instead of the reporting to the preventive medicine centers. As expanded program, that is the non-EPI program. They submit report to the public, to the preventive medicine center. So some of you may be familiar with this chart, with the 10 years history of the NIIS development and the implementation. During this time, we have worked with different small size IT company and the MNOs. So at the small pilot phase, with the small number of the facility and very basic the function of the NIIS, of the immunization registry, we worked with the IBA for the immunization registry and another company for vaccine tracking software. So two software run separately. Working with this small company, so we faced a lot of challenge when we wanted to adjust the requirement, add the new function, new reporting template. That took a long time to negotiate them, and they are limited capacity to develop the big system and also the technical support for end user when we want to expand to the larger area. And also that they have if you work with the small side IT companies, we have to face with the frequent developer to turn over from the small side IT development company. So therefore, in 2013 and 2015, to expand, we expand the immunization registry in the Viettel province and Viettel across the country. So we worked with an IT consultant, and also after that we hired in-house staff to integrate the immunization registry and the vaccine tracking into one comprehensive system, and also to work with small MNO for the sending the reminder SMS. In 2016 and 2017 marks the turning the point in the implementation of the immunization registry and vaccine tracking. MOS worked with the Viettel with support from the PAT. So the Viettel is one of the biggest MNO in Vietnam to upgrade the system and upgrade and scale up the nation, upgrade to the National Immunization Information System, and we scale up the nationwide with the high commitment from the government, with the very commitment and from the deputy Prime Minister Vũ Đức Đam to his coming and launch this system in 2018 and 2021. So the WINAP and PAT, we work together to support some province to move forward to paperless reporting. And this chart that you may know already about the NIIS is the compulsory use at all the facility who to provide the immunization service and birth delivery, including both the public, private hospital and the fee-based immunization facility. So you can see that the private sector play an important role in immunization the data science to track the immunization of the old people in Vietnam, not only the children and the pregnant women. And there are many facilities who had to work with the private software development company to develop their own system, and based on their own requirement. And also these systems linked with the NIIS via the API. We call that the application program, the interface to exchange the immunization data. So you can see that the public-private partnership is very important to strengthen the implementation of the NIIS and also to strengthen the immunization data in Vietnam. So the public-private partnership is a very important approach suggested by the UN Sustainable Development Goal in providing the better service and goods for the population, as well as create the opportunity for all the people in the world to reach health service. The NIIS implementation in Vietnam is a case to tell the ongoing story of the sustainably planned government run nationwide EIR that demonstrates the public-private partnership in both building, the contracting, the infrastructure, and the service delivery. So the NIIS is a product of the partnership between the Vietnam Ministry of Health and the country's largest mobile network operator, the MNO, Viettel Business Solutions Corporation, and the NIIS, the nationwide implementation, entails the extensive engagement of the fee-based immunization facilities that have expanding the reach of the immunization service to the population. And so next, I hand over to the Dr. Huyền, so she will share with you in detail about the MNO partnership in the action for health. So Dr. Huyền, please.
So you may know that if you want to improve a system at this scale, it's imperative to work with a big company like Viettel, as you know that MNOs by network operation is joy of most to a large capacity as well as the large presentation in the country. The financial secure and of course they have able to provide the necessary human in both quality and quantity. During an MNO, this would be the largest one with the longest history of successful in the country of implementation. We are based on several the core variable to select the MNO. That's the first one. They should have the core connectivity. You may know that Viettel is the largest, one of the largest MNO in Vietnam, with the large network of mobile services and an expansion network ranging from the urban to rural area, as well as that they have a good services, easy to access the internet with the Viettel, even in the hard to reach popular areas. And they have also have a wide support infrastructure. They have a large human resource. They can provide the support for the end user from the commune to district to nationwide. And they provide the consistent and frequent update from their system based on their groundbreaking new technologies as well. They promised to apply this system rapidly. Now Viettel not only work on the National Information System, but they also to develop a series of their database for the Ministry of Health, for drug, for the disease surveillance, as well as other notification system. So they have their experiences on the human resource as well as they based on the previous system operator. They can provide the capacity of implementing a large-scale project rapidly, as well have the experiences successful to have a successful work with the big data. And for the infrastructure, Viettel have a well-established business. They have a know-how in Vietnam as the largest mobile network provider. And we know that they are a popular brand for clients over the country. And it have a capacity to reach and the with the wide network. So Viettel have a large capacity and global presence with services in several abroad, in addition to Vietnam. For the partnership benefit for stakeholder from the Ministry of Health perspective, the National Immunization Information System require a significant capacity from the technology later for the technical robustness as well as maintenance of the system. So we need to have a high capacity data storage, well organized, and also analysis. The partnership with MNO can provide the Ministry of Health with the large data capacity, upkeep organization, financing to maintain capacity, as well as allocation of resources, because they need to invest a lot for the infrastructure for the IT. From Viettel perspective, they have their advantage of the partnering with the health sector in the previous project. They can increase the value of the brand name, and the niche Viettel would expand their spectrum in services in the content, technology, implementation, experience, and relations and credibility. And they also provide the support and funding. You may know that recently, even we have some challenges in the mechanism to work to fund and for the national for the NIIS, even though Viettel can continue on this, even we have no fund yet for this. And anyway, Viettel is a for-profit business, so we would like to support the Ministry of Health to develop application for the health sector as well as contribute to society. Mr. Khổng Văn Đông from Viettel have confirmed this. For the partnership during the development of the NIIS, you may know that the NIIS Technical Working Group have formed to finalize and maintain the user-friendliness of the NIIS system, to collaborate in the meeting, and user need to regard up to the client and vaccine tracking capacity, and to generate the report for the high-level decision-making. The TWG contribute to sustainability and technical implementation of NIIS in Vietnam. From NIIS, National Information System, we have provided technical lead on the business need analysis and as well as developer of user requirement, the reporting system and reporting mechanism. So what do we need? That's the thing we need to do and respond to this. And from the GDPM MOH, they inform us the coordinator of the connecting of all stakeholders together, administration support, and to push the province implementation and policy change. And from Viettel, they provide the system and develop and maintain. From past, they have already provided technical support and advisor to the all stakeholder. So the connection between the immunization, general health and technology, and the facilitator, the communication between TWG member. So during this partnership development, we have already maintained the communication between the partner agencies involved in the development of the NIIS. And we also continue the maintenance and upkeeper of the system. We also improve the collaboration and solving the challenges and facilitating the improvement. From the technical working group deliverable, we have already provided the analysis, business, and the use requirement as needed. And we also developed the use manual to identify the appropriate way to implement the system in the form of the high-level implementation guideline. We, of course, also collect frequently the feedback and analyze from the end user, and also we have analyzed data for the consistent and constant improvement of the system. You may know that the system is not the fixed one. It's often update and need the requirement from the actual. Example, new vaccine introduction, the new SIA, so we should update the system frequently. And during this work, we have a challenge, and also we learn lesson from all the partner. You may know that we should consider when we develop the system between the long-term and short-term investment strategy for the NIIS. We have also the financial constraint. Even we have a fund, we have budgets, but we cannot pay for the developer Viettel, as well as we have a challenge and some barrier on the financial mechanism. And thus the Viettel is a different business model. So we should consider on this. And the fourth, that is a security, how we can secure the data with the loss of the database. Now in the system, we have more than 23 million of the record in the system have already registered. So how to ensure the own 14,000 facility, they secure the personal data. So that is the challenge for us. Even Viettel is one of the largest company with good capacity on this sector. But anyway, for further access the data, we have electronic immunization. We call that the book, but that is the app, the mother that allows the mother can access their children immunity history. So how to ensure that all data will be secure, that's one of the challenges that we need to think about it and develop more and work more on this in the near future. Regarding to learning curve and ability to exchange and to understand information among the partner, that challenge, we need to barter between the developer, the user, and also API. So that is the long process to understand well between the different among the partner. And the last one is the formal arrangement for the launching and implementation of the system. So that's the thing we have already learned for 4 years. So it happens. We know that we have a more challenging, but we have more chance to develop and use the data, not for the monitoring the coverage, but also for API management. We also understand that the NIIS system is not perfect one. But anyway, Viettel is committed to increasing the data input as well as facilitate the automatic generation of the report for repository. The NIIS system now, they meet our requirement for tracking patient, but it needs to be improved more, and more function need to be added to support the end user in near future. Example for the planning, the immunization session, to tracking where they are, or somehow to identify and manage the population. And NEPI need to continue working with Viettel as well the part, and also understand well more the requirement from the end user to finalize the system. As with the part, continue support in the technical, and also GDPM facilitates the policy change as well as mobilize the commitment at the province level. Now we are in the province to provide the training for the lower level to continue and develop, to launch the electronic reporting system. And we expect in the near future, we will encourage the province and low level to use the data in the system for their API management. And we expect that they will decrease the workload of the end user, as well as the retention and improvement of the data quality while reducing the duplication. Thank you.
So next, two.
So my colleague, Mr. will now share information on the public senior engagement.
For private sector engagement, the following part of the presentation will be talking about our effort to engage private sector in using the NIIS. And in particular, here we're talking about fee-based immunization facilities. As you remember on an earlier slide that Sang has presented, the fee-based facility outside of the structural hierarchy of NEPI and the General Department of Preventive Medicine, they report under Provincial Health Department. And at the same time, for immunization service, they also have to report to Provincial Center for Disease and Control, the CDC. However, they follow the same NEPI standards and guidelines, including mandatory NIIS usage. Now, within the framework of IDEAL project, we had looked at, implemented at Sơn La province and Hanoi. And in these two, you can see in the chart, you can see the distinct difference between Hanoi is a urban capital of Vietnam and Sơn La is a mountainous province. And the urban area have significantly higher number of fee-based facility. However, regardless it's urban or rural area, the numbers of base facility are growing in Vietnam. And a couple of reasons is that the populations in big cities that transition to middle class status, and they have the money for private option. Also for fee-based, they provide, they give parents and caregiver the flexibilities. Instead of the EPI system, they only have 1 or 2 immunization days a month. Fee-based facility operate daily on the office during the office hours. So parents and caregiver can plan their own immunization times. Also fee-based facility have available alternative vaccines, and especially the companies such as DTP, IPV, and HIP that reduce the number of shots for a child. And finally, the mentality of you get what you pay for means that the free of charge EPI service is not as good as the fee-based. In terms of immunization management at district and provincial level, the most benefit of NIIS is the ability to check client who frequently move from place to place, or in this case, a fee-based facility, they can move from one facility to the next. And NIIS help with following the vaccination history of the child. For a smaller fee-based facility without who don't have any system, they would fully appreciate NIIS like the EPI facilities, as they can eliminate paperwork and reduce workload. However, for larger fee-based facility, they themselves already had their internal immunization system to manage their clients. The NIIS mandatory. Oh, can you see the next slide? Okay, sorry. So for larger fee-based facility, they themselves already have the internal immunization system to manage their client. So the NIIS mandatory regulation requires them to adjust their adjust their immunization data input and flow. There are 2 ways that these large fee-based facility would take on. They either have an API, it's the application program interface, to transfer data from their own internal system to the NIIS, or they would have to enter data in both systems, the NIIS and their own software. And each way have their challenges. For the double data entries, the obvious challenge would be double work, the workload burdens. Sometimes they have to hire another staff to just do the data input to the NIIS. The other, but for the API data transfer, challenges would be the lack of guidance. This is one of our lesson learned. There wasn't any official introductions or instruction on how to use API to transfer data, nor are there any standard operation procedure for developing an API. There was also lack of communication mechanism between MOH, Viettel, and fee-based facility for requesting and providing an API. And another challenge would be cost burden. So the additional cost for API development is not supported by the government. So the fee-based facilities would have to bear those costs. And lastly, they also have concerns for the privacy. Base are afraid that private information is being disclosed when using API to exchange data, since their internal data would be transferred to the NIIS. And they would have additional data that NIIS doesn't collect, including the financial information. Now, this privacy concern loop back to the lack of guidance, SOP, and lack of communication mechanism. Moving forward, we are looking for a stronger legal framework NIIS, particular focus in the private sector. We also have e-immunization card implementation. It would be an apps on the phone that provide the parents with immunization record for their child. That way they can see what had been injected, and they can follow up with the with the child's immunization. And there should also be regular supportive supervision with the fee-based facility. SOPs and standardized system for data quality monitoring for fee-based. There's also increased cooperation between EPI facility and fee-based facility, not only in data collections, but also in data quality assurance use. Refresher training for data collections and use should be conducted. Client data management should be tightly controlled at district level and up. To conclude this part, Vietnam will have to develop more coherent NIIS policy with a particular focus on fee-based facility roles and responsibility on a mandatory mechanism to ensure compliance. At the same time, it is essential to create interoperability standards so that the fee-based facility can exchange data between their internal system and NIIS. And finally, building a human resource capacity to understand and use the system is vital for supporting the daily work of immunization and to serving Vietnam population. I would like to conclude this presentation. The National Immunization Information System of Vietnam showcased the multiple public-private partnership that Vietnam Ministry of Health has committed to developing and maintaining information technology infrastructure, the National Immunization System, and to enhancing data quality and use with the engagement of the fee-based facility throughout the implementation process. Experiences from partnership with private sector and NIIS in Vietnam hope to provide lesson learned for other countries with similar context and interest in EIR implementation. That concluded our presentation. Would you, Alex?
Yeah, thank you very much. Is there any further questions?
Alex?
Yeah, can you hear me? Can you hear me?
Yeah, I can hear you now.
Okay, good. Yes, thank you very much. Is there any further question from the audience? You can raise your hand or you can write it in the discussion or Q&A window. No question. Okay, thank you. Dr. Nga, Tu, is there anything else you would like to add?
So thank you so much for your time today.
Okay.
What we saying, and I hope if we still have a question, you can send the question via. If you cannot ask now, oh please.
There's a question from David. David, would you like to write your question or would you like to speak? David?
He said that he don't think that he doesn't think he can speak.
Okay, let me give you. Okay, David, if you want, you can speak.
Hi, can you hear me?
Yes.
Hi, thank you. Thank you for the presentation. It was incredibly interesting, and thank you for taking my question. You coming from a funding organization, I'm always interested in how many different groups have to come together for something like this to be successful, and especially with complicated funding streams coming from places like Gavi or the Gates Foundation or the ministries. Can you talk a little bit about how and how the funding and organizational and reporting aspects were coordinated and handled kind of across the complicated program? Thank you.
Thank you for your question, David. Actually, we have a lot of different funding sources and different donors for different times. Because as we said from the beginning, this is our long journey, almost more than 10 years, 11 years actually, in Vietnam, to go from small pilot to nationwide application. And from the beginning, one of the key stakeholders we engaged in from the beginning, that is very important that the government partner, that's the national EPI, and also later Ministry of Health, also very engaged during the process of deployment, piloting, scale up, and evaluation. So that also noting is a very key stakeholder. And for funding source, honestly, that part during 11 years have received a lot of continuous support from different donors, like from Gates Foundation from the beginning, and then we get more funding from UN Foundation for scale up to the whole province, and then we got we have been awarded by Healthcare Innovation Award by GSK and Save Children, and with that award we are able to help Ministry of Health to integrate the immunization registry and vaccine tracking system into the NIIS in 2016 and 2017, and then with more funding from Gates Foundation and also scale up nationwide, and with more funding from Gates Foundation now, we are supporting the government in selected province in Sơn La, Hanoi for transition process to paperless, also to document the lesson learned and share widely globally and regionally. And just last year, we got more funding from Gavi to support, to expand support for transition process for additional 4 provinces. Also develop some technical guidelines for implementing transition process at national level. At the same time, the national EPI also mobilize some funding from WHO and also from Gavi for the additional training and support. So that's also those different funding sources come to the different time. I hope I answered your question.
Yes, thank you.
Thank you, David. Any further question? No further question. All right, so this presentation is being recorded, so we'll share the presentation as well as the recording by email. We send that to you. And yes, if you have any further question in the future, you can perhaps Tu or Dr. Nga, if you can show again your email address.
Yes.
On the slides. Yeah, please don't hesitate to contact Dr. Dang or Mr. Dao in this email address. You can also contact them via TechNet. You can contact me if you have trouble to contact them, and I can help you to reach them. Thanks again, and I wish you all a great day or evening wherever you are. Thank you very much, and see you to the next webinar. Bye-bye.
Thank you. Bye-bye.
Bye-bye.